As far as the procedure that I had, what led up to that was the frequency for which I would have to urinate. When I was playing golf, every other hole I was looking for a tree. I just couldn't empty my bladder. Maybe I ought to go get this checked out. I had a trip coming up in June. This was in February, and I didn't want to have to be walking down the streets of Copenhagen in June going, where's the restroom? I need a restroom. That also prompted me to go see the urologist.
With Randy, when he came to me, he'd already been on medicines for 5 years. And a lot of guys do that. They're like, oh, I can live with this. Isn't that bad? There's so much more we can do nowadays instead of just having somebody on medications for a decade and stuff like that. And so by the time he came to me, he was ready to get something done. This was definitely affecting his quality of life. Given the size of your prostate, we feel that a GreenLight Laser Vaporization of the prostate is going to be his best option. He was all for it. He was ready to go. He was ready to get something done, ready to kind of get on and see an improvement in his urinary quality of life.
Probably within 2 months, I'd had the referral, the examination, the results of the examination and the procedure. The fact that I don't have to consistently and persistently look for a restroom is a godsend. I played 18 holes of golf yesterday and didn't go to the bathroom until I was done. That's better than going 6-8 times during a round.
I golfed a full 18 holes without having to stop, and so that was what he was most excited about.
It accomplished what we set out to accomplish in the beginning. We've done our international trip. We went to Denmark, Sweden, and Norway for 14 days. Like I said before, it was a godsend.
Patients come to us because they have problems, and those are some of the tough parts of it. But when you fix that problem, they come back to you. That's some of the most rewarding parts of it.
When he walked in the room and he asked me, how are you doing? I said, Doc, you are a rock star.